Drugs can be classified based on their effects on the central nervous system. Next, we will explain the main types of drugs according to their effects on the nervous system. We will see examples, highlighting some of their most important effects and health problems they can cause. And we will see some stories or interesting facts related to their use or effects. Part 1. Stimulant drugs. These drugs increase the activity of the central nervous system, increasing energy, alertness, and in many cases euphoria, that is, intense enthusiasm and joy. They also increase concentration, reduce hunger and sleep, causing insomnia problems. In addition, they raise heart rate and blood pressure, increasing the risk of cardiovascular problems. Illegal stimulant drugs such as cocaine and amphetamines produce intense euphoria by releasing large amounts of dopamine in the brain, a brain neurotransmitter that is associated with pleasure. However, this effect is temporary, and when it disappears, it is usually followed by an emotional crash that can lead to irritability, anxiety, and even depression. Excessive or chronic use of stimulants, especially those such as methamphetamine or cocaine, can also trigger severe symptoms of anxiety, paranoia, and even psychosis, with symptoms such as hallucinations or delusions. Let's see some examples of stimulant drugs. Caffeine, present in coffee, tea, and energy drinks. Nicotine, present in tobacco, is the addictive component of cigarettes. Tobacco, despite being a legal drug, should be banned, as it is responsible for a third of all cancers, multiplies the risk of developing cardiovascular diseases by 2 to 4 times, and multiplies the risk of developing chronic respiratory diseases by 4 to 10 times compared to non-smokers. Cocaine produces an intense feeling of euphoria and energy, but with serious and potentially fatal side effects. Cocaine multiplies the risk of having a heart attack up to 24 times within the first hour of consumption, even in young people without previous heart problems. Methamphetamine, powerful stimulant known as crystal meth, associated with rapid addiction and neurotoxic effects. Amphetamines, like speed or prescription drugs like Adderall and Ritalin, increase heart rate and blood pressure, increasing the risk of heart attacks and strokes, causes extreme fatigue and depression after use. Abuse leads to mental health problems, such as anxiety and psychosis. MDMA or ecstasy produces a mix of stimulant effects and increased empathy and sociability, increases the risk of depression, anxiety, and memory problems. Let's now look at some of the many curiosities and historical events where stimulant drugs have been used. A famous case is that of Sigmund Freud, who experimented with the use of cocaine as a cognitive enhancer and analgesic. At the end of the 19th century, he prescribed cocaine to his patients for depression, not yet knowing its high addictive potential and neurological damage. Another curiosity is that in the 1980s, MDMA was used in couples therapy as it was believed to help people express their emotions. However, its popularity in nightlife and raves led to its ban in many countries. The coca leaf, which is the plant from which cocaine is obtained, has been chewed by indigenous communities since pre-Columbian times to combat fatigue, hunger, and the effects of altitude in the Andes. The Spanish conquistadors soon realized its stimulating effects and began to use it, especially to maximize the work performance of the indigenous people in the gold and silver mines, such as those of Potosi in what is now Bolivia. Through a system of forced labor known as mita, thousands of indigenous people were forced to work in extremely harsh conditions. To endure long working hours in hostile conditions, they were given coca leaves, which helped their physical and mental resistance, since coca reduces fatigue, sleep, and hunger, obtaining perfect slaves. The conquistadors even promoted its cultivation and trade, recognizing that it was key to maintaining productivity in the mines. Obviously, these enslaved miners deteriorated and died at a very young age due to the effects of the drug and working conditions. In more recent times, cocaine has also been used by mafias to obtain slaves in brothels. During the invasion of France and other campaigns of World War II, the German army under Hitler's command widely used a drug called Pervitin, which was a form of methamphetamine. This stimulant substance was distributed among the German soldiers. Methamphetamine allowed soldiers to stay awake for days, advance without apparent fatigue, and maintain a constant state of alertness, which was key to the initial success of the invasion campaigns in Western Europe. Obviously, the soldiers had serious side effects, such as anxiety, aggression, paranoia, and dependence. In addition, Its prolonged use led many to suffer mental and physical health problems with long-term effects. A more well-known story was that of the famous soft drink Coca-Cola, which was created in 1886 as a medicinal tonic and was sold in pharmacies. Its formula was intended to help with health problems such as headaches and fatigue. The drink initially contained coca leaf extract, hence its name, and cola nut, a source of caffeine. At that time, cocaine was legal in small doses and was used in various pharmaceutical products, as its addictive and harmful long-term effects were unknown. Coca-Cola contained a small amount of cocaine, although it was not pure cocaine, but a low concentration that came from the coca leaf. As the risks of cocaine became better understood, and with the regulation of this substance in the United States, Coca-Cola removed cocaine from its formula in 1904. However, the company continued to use coca leaves without active cocaine as an ingredient to maintain the original flavor, and still today, they use a legal and cocaine-free extract of these leaves. Amphetamines between 1940 and 1950, and amphetamine-like drugs in the 1990s were used for weight control as they decrease appetite and increase energy expenditure. Currently banned for weight loss due to serious side effects such as insomnia, increased heart rate, high blood pressure, paranoia, anxiety, psychosis, addiction, and neurotoxic effects. Part 2. Depressant drugs. These substances reduce the activity of the central nervous system, causing feelings of calmness and relaxation. They're often used medically to treat anxiety or help people sleep, which has led to many cases of dependence and other long-term problems. They also slow down vital functions like heart rate and breathing, and reduce the ability to move properly and react quickly, which can lead to car accidents. In the short term, they affect memory and judgment, potentially leading to bad decisions. Over the long term, they can cause symptoms of depression and emotional changes. High doses can lead to coma and even death, especially when different depressants are mixed, like alcohol and tranquilizers, as this can stop breathing. Finally, let's talk about opioids. Besides depressing the nervous system, they're very strong painkillers. They're used in medicine for pain management, but they're highly addictive. Let's look at some examples of depressant drugs. Morphine, used as a painkiller in medicine. Heroin, an illegal drug made from morphine linked to extreme addiction and social problems. Fentanyl, an extremely strong synthetic opioid that's been a major factor in the current opioid crisis. Oxycodone, prescribed for pain. It's another opioid that has caused addiction problems in many countries. Alcohol, the most common recreational drug, it lowers inhibitions, but excessive use has harmful physical and mental effects. Benzodiazepines, anti-anxiety medications like diazepam, Valium, or alprazolam, Xanax, used for anxiety and insomnia. Barbiturates, another type of sedative now rarely used due to their high toxicity and risk of overdose. GHB, also known as liquid ecstasy, it's used in party settings and is potentially dangerous. Let's look at some interesting facts and historical events involving depressant drugs. The most recent story is the opioid crisis in the United States, which became a national health crisis in the year 2000, especially with fentanyl. It's so potent that even a small amount can be deadly. Pharmacies were pushing opioid painkillers for many types of pain like fentanyl, oxycodone, and Vicodin, assuring doctors and patients that these drugs were safe and had a low risk of addiction. However, these claims turned out to be false and led to a huge number of opioid prescriptions, triggering an addiction crisis among people of all ages and backgrounds. This crisis has had, and continues to have, a huge economic impact on the United States, in addition to many overdose deaths, health problems, and social problems like increased crime, family breakdown, and job losses. There have been over 500,000 overdose deaths since the year 2000. Pharmaceutical companies, distributors, and doctors faced millions of dollars in lawsuits for their role in promoting these drugs. Another story is that in the 1970s, barbiturates were commonly used by celebrities to cope with stress. However, this led to an epidemic of overdoses, like the case of Marilyn Monroe and Judy Garland, the actress from The Wizard of Oz, who both died from barbiturate overdoses. Another story is the Opium Wars that took place in China in the 19th century. China had a huge problem with opium addiction, a drug that British traders were bringing into China. The Chinese authorities tried to ban opium, which led to two conflicts with Great Britain, known as the Opium Wars. China's defeat led to Great Britain taking control of Hong Kong and an increase in the opium trade, devastating Chinese society with an addiction crisis that affected millions. Another important event was in 1898, when the pharmaceutical company Bayer introduced heroin as a cough medicine and a less addictive substitute for morphine. Heroin, made from morphine, was promoted as an effective painkiller and a treatment for morphine addiction. It wasn't long before heroin proved to be even more addictive than morphine. In 1924, due to the devastating effects of its abuse, the United States banned heroin for all uses, including medicine. During the American Civil War, from 1861 to 1865, morphine was widely used to treat pain in wounded soldiers. However, its widespread use led to what became known as soldier's disease, or morphine addiction, becoming one of the first opioid addiction crises in the United States. During the Vietnam War, from 1955 to 1975, morphine was also used for pain relief in soldiers with serious injuries. But heroin caused many more cases of addiction among soldiers, as heroin was cheap and easy to get in Vietnam. The tensions, extreme stress, and the length of the war led many soldiers to turn to heroin to escape the realities of combat. By 1971, it was estimated that 15 to 20% of American soldiers in Vietnam were regular heroin users, creating an addiction crisis. Prohibition in the United States was a policy that banned the making, transporting, and selling of alcoholic drinks in the country from 1920 to 1933. Prohibition was difficult to enforce and created an atmosphere of widespread disobedience and increased organized crime. The ban created a black market for the production and sale of alcohol. Smuggling and gangs grew exponentially, and corruption affected law enforcement and the political system, so the law was repealed. These substances change how we see, think, and feel. They can cause us to see, hear, and feel things that aren't really there. While these drugs don't cause physical addiction, using them a lot can make you rely on them emotionally. They can cause some people to lose touch with reality or experience mental health problems. Using these drugs a lot can also change how someone acts or feels, especially if they're using drugs to avoid problems in their lives. Some people might feel more connected to themselves, but less interested in everyday things. This can make them withdraw from others and feel alone. Studies show that using psychedelics in a safe and controlled setting with a doctor can help treat things like depression, anxiety from trauma, and addiction. Let's take a look at some examples of psychedelic drugs. LSD, or lysergic acid diethylamide, known as acid. It's famous for causing really strong changes in how you experience the world. It's made from a fungus that grows on rye, psilocybin, the special ingredient in magic mushrooms. Mescaline comes from the peyote or San Pedro cactus and is used in Native American ceremonies. DMT, or dimethyltryptamine, found in some plants. It's a really strong drug that can make you see things very differently, like seeing beings in worlds that aren't real. Let's dive into some interesting facts and historical moments where psychedelic drugs have been used. Psychedelics, especially plants and mushrooms, have been used in spiritual ceremonies by indigenous cultures for thousands of years. In the 1960s, psychedelics became a symbol of counterculture and the hippie movement. Many artists, musicians, and writers have used psychedelics to help them be more creative. Rock bands like the Beatles used LSD, which influenced their albums and lyrics. Even recently, some people who work with technology say they've used psychedelic drugs to help them think better and be more creative. These drugs have also influenced graphic design, fashion, and advertising. Ayahuasca, a drink containing dimethyltryptamine used for centuries by indigenous communities in the Amazon, has attracted people from all over the world in recent years, seeking spiritual or therapeutic experiences. This has led to a whole industry of psychedelic tourism, where lots of people travel to places like Peru and Brazil to take part in ceremonies with shamans. Taking psychedelic drugs can lead to what's called a bad trip, where instead of having good hallucinations, people have scary ones, see things that look strange, feel afraid, paranoid, anxious, panicked, and so on. In case someone had a bad trip, hippies used to take psychedelic drugs in groups, where at least one person would be the trip sitter or guide. This person would stay sober and pay attention to offer support, calm the user down if they started to get anxious, and make sure they didn't accidentally hurt themselves. Part 4. Other drugs. Cannabinoids, phencyclidine, and ketamine are drugs that don't have the same main effects as the three groups we've already talked about, so we'll look at them separately. Cannabinoids change your mood, perception, and appetite. Depending on the dose and the person using them, they can act like depressants, hallucinogens, or even mild stimulants. Cannabinoids include marijuana and cannabidiol, or CBD. CBD is the part of cannabis that doesn't make you high. It's used in medicine to reduce anxiety and pain. The most well-known psychoactive part of marijuana is tetrahydrocannabinol, or THC. One of its main psychoactive effects is euphoria, which is a feeling of happiness or well-being. Your senses might feel stronger, and time might seem to slow down. And it also has a calming effect. It can be hard to remember things or concentrate. Your coordination also gets worse. Some people might experience anxiety, paranoia, or panic attacks, especially with high doses or in an uncomfortable environment. Marijuana is used in medicine to increase appetite and treat different conditions like chronic pain, epilepsy, multiple sclerosis, and autoimmune diseases. Cannabinoids, especially CBD, have anti-inflammatory and anti-anxiety properties. Marijuana use in teenagers is especially worrying because the brain is still developing. Studies have shown that regular use during adolescence can lead to long-lasting problems with thinking, affecting learning and memory even after they stop using it. In adults, the impact on short-term memory and attention is smaller, but they're still affected. Let's take a look at some interesting facts about cannabinoids. Marijuana use goes back more than 5,000 years, and it's been used in different cultures for medicine and recreation. There are hundreds of varieties of cannabis, usually grouped into two main species, cannabis sativa and cannabis indica. Sativas tend to have more energizing effects, while indicas are known for their relaxing effects. The cannabis plant is also used to make fibers known as hemp for textiles, paper, biofuels, and other industrial products. Cannabidiol, or CBD, doesn't make you high and might have medical benefits, so it's used in oils, creams, and supplements. In the Victorian era, cannabis was commonly prescribed in England to treat different kinds of pain. During the colonial period, farmers in the United States were encouraged to grow hemp, a type of cannabis with low THC content, used to make rope, fabrics, and paper. In the 1920s and 1930s, cannabis became popular among jazz musicians in the United States as a way to relax and boost their creativity. Cannabis was banned in the United States in 1937, but soon after, in 1942, during World War II, the United States government launched the Hemp for Victory campaign to encourage the cultivation of hemp for the manufacture of ropes, uniforms, and other military supplies. Phencyclidine, PCP, is a synthetic drug with dissociative effects, meaning that it alters your perception of reality, your sense of self, and your awareness of your surroundings. It was initially developed in the 1950s as a general anesthetic for surgical procedures, but because of its severe effects and potential for abuse through recreational use, phencyclidine is classified as a high-risk drug with no recognized medical use in many countries. Some of the severe adverse and psychological effects it had on patients include extreme confusion, delusions, and hallucinations. Finally, we'll look at ketamine, which was developed in the 1960s as a replacement for phencyclidine, also known as PCP, for human and veterinary anesthesia. It had a safer side effect profile, but it's also used recreationally to experience feelings of extreme disconnection where they might feel outside of their own body. It can also cause feelings of well-being and relaxation. Like all drugs, Ketamine can be dangerous in recreational settings. Recreational ketamine abuse can lead to memory problems, urinary problems, and kidney and liver damage. Intense hallucinations and visions are common in some cases, especially in high doses. One of the most important recent discoveries about ketamine is its ability to relieve symptoms of severe depression and disorders, like post-traumatic stress disorder. Unlike traditional antidepressants, which can take weeks to work, ketamine can produce an improvement in hours or days, and it has become a viable option in the treatment of treatment-resistant depression. Ketamine was widely used in the Vietnam War as a safe anesthetic for soldiers wounded in combat because it didn't require the use of breathing support equipment. The World Health Organization has included ketamine on its list of essential medicines, mainly because it's effective for anesthesia in emergencies and in countries with limited resources, because it's accessible and easy to administer. In conclusion, we've seen how drugs have been misused for recreation, crime, war, and medicine. And although lawsuits have been filed against pharmaceutical companies that played a key role in the opioid addiction crisis, the social, economic, and health damage is already done. Therefore, even medical use should be much more controlled and reduced. Although drugs can have medical uses, their side effects can always be dangerous, especially in high doses or when taken for a long time. After what happened with other drugs that have been used in medicine, where the pharmaceutical industry claimed they weren't addictive and had few side effects, which turned out to be completely false, we can't trust the supposed medical benefits that are being discovered for psychedelic drugs. It's clear that recreational drug use often leads to abuse and harmful effects, and that both medical and recreational drug use can lead to addiction. I hope you liked the video and found all the interesting facts and stories about drug use interesting. Leave a comment if you know of any other interesting facts or stories about drug use that weren't mentioned in the video.